Hello, I'm Nick Guldemond, a professor of healthcare and public health, and a warm welcome to this video masterclass of IEDC. Let me share some slides with you. So I've been working with the IEDC Bled School of Management for quite a while, doing different thing. And I gave last year a masterclass on the impact of technology on leadership in healthcare. In my daily work, I help countries with transforming and improving their healthcare systems across the globe. So this can be Latin America, or in China, or in Eastern Europe, Eurasia. And often digitalization is an important aspect of this transformation and improvement. So different hats and different roles by which I know healthcare systems from a policy level as well as from a ground floor reality. We have different challenges and developments in healthcare systems, which are roughly apply to all the continents and in many countries. So we share a lot of the same sort of challenges. And one of the major challenge already for some years is aging populations. So when society age, people develop also more problems while they growing old. They have developed diseases, chronic diseases, and often multiple diseases at the same time, which is called comorbidity. And that puts the healthcare system in quite a challenge because healthcare, the use of healthcare is rising, while over the years and also for the future years, the resources are becoming less. So less people and less money available, as what you also see in the slide here. So an increasing demand while we have lesser resources. And this is also further accelerated by, for example, geopolitical tensions and more spending on defense budgets, which cannot be spent on health and social care. So also a gradually increasing pressure on healthcare systems is the climate change, which translates in more disasters and threats to countries, to continents, but also the outbreak of all kinds of diseases, and also all diseases coming back in continents where they were eradicated in the last centuries. So on top of these, let's say, slowly increasing challenges in the healthcare systems, we have also instantaneous sudden threats like infection outbreaks, as what we saw with COVID. But before COVID, we also have SARS and MERS in this century. And every year we have the flu outbreaks, which also in many countries you can see a spike in the use of healthcare, and which is very difficult to manage with the resources we have. So this creates a really a challenge for the stability of healthcare, but also for the whole economy. So this is a major thing where we have to deal with in the future years. Another major development, as what you also heard in all kind of media, is technology innovation, and specifically AI. And so there are many developments and innovations in healthcare, which sounds very promising. And also AI is considered to help us with tackling all these challenges described in the previous slide. But we know also from the last years that digitalization, innovation is not that very easy when you really want to make healthcare better and more accessible for people. So the question is also for leadership on where should we invest in for a better future healthcare and a thriving economy. What we see often in these innovations, and especially the use of technology, and AI is not an exception, that it tends to increase cost. And here you see a graph where you see the impact of aging, which explains only 1/3 of the estimated cost rise in the Netherlands. And 2/3 is explained by the use of innovation, technology, and new pharmaceuticals, which doesn't necessarily translate in better healthcare at lower cost. So there's also the challenge, how can we make all these innovation meaningful and affordable and useful in a proper manner? And considering also all these hypes, also related to AI, it's asked a very strong leadership and also understanding about the limitations and opportunities of technologies to make proper use of them. So if you look to opportunities, innovation and developments, it's not so much if you look from a global health systems perspective on the innovation side, but the challenges are more at the adaptation or the market size. So we don't have to complain about all potential wonderful ideas, technologies, and innovations. And they are there. There's also huge budgets which can be spent on innovation. See, for example, AI. But the problem is that these solutions developed often don't reach the people and can be used in a market in a proper way. So rather than looking at all kind of innovation opportunities, it's more as leaders to think, how can we organize the market in order that we can improve adaptation in affordable, sustainable, and cost-effective manner. So Europe is perfectly placed to create this market, but there is still a lot to do. So that also points to the more regional or continental sort of perspective on that we have improved this sort of market functions. And this poses a challenge for policymakers, politicians, and leaders in healthcare. So we have challenges which are quite huge and which also poses future challenges for economies. But the good news is we have a lot of power, ideas, and also money to change that in a very positive way. So the implication for leadership is that we should embrace these developments in a proper way. We have to think about a very person-centered approach, which can be used for a better quality, operational efficiency, and eventually leading to better health outcomes for people. So therefore, we have to navigate in a very complex ecosystem, not only with healthcare providers, but also with industry, with the patients, with policies and authorities, with investors. And so in order to lead this sort of change, we have to understand these ecosystems and also the political dynamics. So in the end, as a leadership for healthcare organizations or within governments, we have to balance the change which comes with all the opportunities and the adaptations in a very human-centered approach, and to play on this level, on these different levels in healthcare systems, a policy level, operational level, tactical level, we have to really develop different skills than we had, for example, a couple of decades ago, when it was all more or less complex and more single aspect focus. So we have to think really careful about planning and resource allocation, considering that we only can spend the money once. And we have to really take careful on what is really useful and what should we adapt considering cost and benefits. Especially for the EU, it's important that we work well on a regional level, like provinces and localities. At the same time, at a national level, but to improve the market, work on public health, like infection outbreaks, to secure proper investments at a European level. We have to work with these partnerships on different levels for success. So a strong network, and also use others to create these networks, a clear vision, which goes in the more, let's say, policy level as well as more operational, is required, which also makes a good understanding of healthcare systems and also how healthcare markets work is quite critical. So I hope that I provide you a little bit of insight on the future challenges and what we can do in order to make these challenges into successful opportunities and impact for societies. Thank you very much, and hopefully till very soon.